symptomatic. That means when these worms they are present in the body, they causes chills and fever, etc. For that, to reduce that symptoms, chills and fever, we call it is symptomatic. That means you are reducing the symptoms, but you are not eradicating the worms. So third treatment is eradication. That means you have to completely eradicate the worms from your body. Okay, so they are the treatment modalities. Now coming to the treatment of filariasis. The drug DC, that is diethyl carbamazine, 2 mg per kg, 3 times a day. It produces rapid symptomatic relief. Why that symptomatic relief? Because that microfilaria, they will be traveling in the lymphatic system and also in the bloodstream. So they will disappear. The microfilaria will disappear from the blood and the patient becomes non-infective to the mosquito. Even if the mosquito bites, because this microfilaria will disappear from the blood, they are not present, these larvae. So that the person becomes non-infective in 7 days. But the adult worm will survive in the lymphatics, and that will give rise to intermittent microfilariemia and symptoms. What is that microfilariemia? That is the population of microfilaria increase because adults are surviving. They will progenate, produces more larvae, and these larvae, when they are released into the bloodstream, they cause symptoms. That is the chill, fever, erythema, etc. So if we give for just 1 week, what will happen? No doubt the person becomes non-infective, but the adult swarm will survive and they give rise to intermittent microfilariemia accompanied by the symptoms. So to control this, prolonged treatment with different schedule is needed for radical cure. What is that radical cure? You are removing the adult worms also. That is the final, what we say is a radical cure. Now for that, what you have to do? The total dose of 72 to 126 mg per kg. Earlier for symptomatic relief, what was the dose? 2 mg per kg TDS for 7 days. Here 72 to 126 mg per kg, that is the total dose. And this dose is spread over 2 to 3 weeks. Then that is called one course. 126 mg per kg spread over 2 to 3 weeks, divided in divided doses 3 times a day. That is one course. Such courses, more than one course, that means approximately 3 to 4 courses are required to produce a radical cure. Now, that elephantiasis, that means thickening of subcutaneous tissue because the lymphatics are blocked. There is no drainage of lymphatics and that lymph will collect subcutaneously and gives the structure to the extremity, either the leg or the upper extremity, thickened structure, non-pitting edema, and that is called elephantiasis. So this elephantiasis is due to chronic lymphatic obstruction. If that is there, this drug is not going to change that. because that fibrosis, what happened, the fibrosis of the lymphatics is irreversible. So that's why that cannot be treated with this drug. Now, the people who are in endemic areas, how to eradicate them, how to protect them, how to prevent them becoming the victims of this filariasis. So for that, yearly, that means every year, this course has to be repeated. What is that course? Combined drug. One is DEC, diethyl carbamazine, dose 6 milligram per kg, single dose, combined with albendazole of 400 milligrams. So in single dose, these two drugs are combined. DEC 6 milligram per kg and albendazole 400 milligram per kg single dose on mass scale for everybody living in that area, has brought down the transmission of filariasis by reducing microfilariemia. That is for chronic prophylaxis. So now, if we say the treatment, one is symptomatic cure, second is radical cure, and third one is in the people living in the endemic area to prevent the people getting every year that infected. That means yearly as a chronic prophylaxis you are giving. That is the different doses and course of treatment. Now what is the second use? This drug DEC can also be used in tropical pulmonary eosinophilia. Now this is the condition where the eosinophil count is more than 5% in such individuals. Their symptoms will be similar to that of bronchial asthma. They will have dyspnea, difficulty to breathe, cough, etc. Many a times it will be mistaken for bronchial asthma. So to diagnose, if you subject that person for differential WBC count, then you will find that eosinophil count is more than 5% in such individuals. So that condition is called a tropical eosinophilia. And again, the reason for that is the microfilaria which are traveling through the system, that is the vascular system. Their products of metabolism, they are absorbed by the body and it is an allergic manifestation. How to treat this tropical eosinophilia, which is mimicking bronchial asthma? DEC 2 to 4 milligram per kg 3 times a day for 2 to 3 weeks. It shows dramatic improvement in signs and symptoms. That means the breathlessness, dyspnea, etc. will disappear. The cough, it will not respond for that. For that cough, you have to give inhaled corticosteroids. That is the treatment for pulmonary tropical eosinophilia. Now, what are the adverse reactions of this drug? Nausea, loss of appetite, headache, weakness, dizziness, leukocytosis, and mild albuminuria. Now there will be sometimes febrile reactions with rashes, pruritus, enlarged lymph node, bronchospasm, and fall of blood pressure. All these, it is due to mass destruction of microfilaria and adult worms. Now what will happening here is the drug will kill the microfilaria. So those substances, they are absorbed. Similarly, the adult worms, when they have become gravid, they secrete certain substances Again, they are absorbed by the system. They causes this type of allergic reaction. So for that, what is the alternative? If the patient gets this rashes, fever, etc. during the treatment, the main reason is massive destruction of microfilaria. So to prevent such reactions, there are one or two alternatives. What is that alternative? Start the drug with low dose. That means you are preventing mass destruction. Normal dose is 2 to 3 milligram per kg. So small dose 0.5 milligram per kg 3 times a day. Then you are increasing the dose every day by 0.5 milligrams. So full dose will be after 4 days. So first day 0.5, second day 1 milligram, third day 1.5, fourth day 2 milligram. Fifth day, if you want, you can give 3 milligrams. So 2 to 3 milligram per kg, 3 divided doses. So that is one way. Or if you have already given the full dose, if the patient has got severe reactions, the DEC can be stopped temporarily. You can discontinue the drug and you are treating the symptoms. That is the fever, rashes, chills, etc. with antihistamines or with corticosteroids. If the symptoms are mild, give systemic antihistamines. They will subside. Then afterwards, you can start DEC. With antihistamines, if the symptoms does not stop, then you have to start corticosteroids, systemically used corticosteroids. So when once the symptoms subside, subsequent administration of DEC will not cause such reaction. So to prevent allergic reaction, you have to start with a small dose, increase every day, arrive at the full dose by 4th day, complete the course. Or if the patient does not get the symptoms free, then you stop the drug temporarily, use antihistamines and or corticosteroids systemically, both of them. When once all the symptoms are subsides, then you start DEC with the full course. The patient will not get such type of reactions. That is about DEC. The next drug is ivermectin. This ivermectin is extremely potent. It is semi-synthetic. And this drug is obtained from Streptomyces over-mitilis. It is from the product of bacterium, Streptomyces. Now this ivermectin, this is the drug of choice for onchocercias, stranguloides, etc. along with microfilaria. This is microfilaricidal. It will kill the microfilarial larvae, but not macrofilaricidal. Whereas DEC, it is microfilarial with the single course. But if you prolong that for 2 to 3 courses, in between giving gap of 2 to 3 weeks, it becomes macrofilaricidal, DEC. But here, ivermectin is microfilaricidal, but not macrofilaricidal. What is the dose? 0.2 gram per kg, single dose. This is most effective. Oh, here it is a small mistake. This is not a gram. No, here it is a mistake. It is not 0.2, it is 0.2 milligrams. It is not gram, 0.2 milligram per kg. Single dose. This is highly effective in cutaneous larva migrants. Cutaneous larva migrants is a stage where that larvae, they are migrating in the lymphatics. It causes rashes, chills and fevers. And also it can be used in ascariasis also. Now what is the mechanism of action? It causes tonic paralysis of the nematodes, that is filaria, ascaris, etc. How it causes tonic paralysis? No, in its system, that is in this invertebrates, there is a special type of glutamate gated chloride channel. So this drug acts through glutamate gated chloride channel and it causes tonic paralysis of the muscles of the worm so that they cannot adhere, they will be passed out. Now single dose 10 to 15 milligram or 0.2 milligram per kg of ivermectin plus 400 milligram of albendazole is given orally for 5 to 6 years, that is in an endemic area. So acute attack can be treated with 0.2 milligram per kg of the body weight, single dose. Then chronic prophylaxis in endemic area, single dose of 10 to 15 milligram of ivermectin combined with 400 milligram of albendazole. It can be given annually for 5 to 6 years. Then a single dose of 0.15 to 0.2 milligram kg, highest cure rate in stranguloidosis. This ivermectin also reduces the burden of intestinal nematodes. Then another use of this ivermectin is in scabies and pediculosis. And this is the only drug which is given orally for scabies and pediculosis. If you see the other drugs, they are applied in the area with different scrubbing, etc. But here this ivermectin is given orally for scabies and pediculosis. It is very effective. Single dose of 0.2 milligram per kg. This ivermectin is given orally. It is well absorbed, wide distributed, but it does not cross the blood-brain barrier. So it cannot enter the CNS. Sequestrated in liver and fat, that is where it is stored. Metabolized in the liver, plasma half-life 48 to 60 hours. Long plasma half-life. Then pruritus, giddiness, nausea, then abdominal pain, constipation, lethargy, these are all mild adverse drug reactions. Now sometimes when you treat this patient with that, the person may get fever, urticaria, etc. It is mainly because of the degenerated products of microfilaria. If it is severe, you can treat with antihistamines and steroids. The drug is not safe for pregnant lady and young children. So you cannot use them during pregnancy and for young children. The drug is contraindicated or you have to use with caution because there is a drug-drug interaction. What type of drugs? The drugs which have the similar type of glutamate chloride channels, GABA drugs, GABA amino butyric acid. What are these drugs? Barbiturates, benzodiazepines, valproic acid, etc. So you cannot use this drug along with these drugs. They are contraindicated to use with these drugs. As I said, it is not safe during pregnancy, and if there is impaired blood-brain barrier, that means meningitis, you cannot use this drug. Children under 5 years of age. Next is third drug, what is called albendazole. This is an alternative drug. This is not the first choice. Albendazole is broad spectrum because you have already heard them as an anthelmintic. It is a broad spectrum anthelmintic drug. So that can also be used in filariasis. Broad spectrum. It is excellently tolerated. Another advantage is it is used only as a single dose. It can be administered in single dose. And this drug has got weak microfilaricidal. It is also effective in larval migrants. What is the mechanism of action? It acts by binding the beta tubulin. These tubulins, they are the skeletal system of the organelle. They inhibit microtubule, its assembly and synthesis is affected. So leads to disruption of microtubules by selective and irreversible inhibition of glucose uptake. So by blocking the glucose uptake, it will block the metabolic pathway. Ultimately, it will lead to the death of the parasite. By blocking its metabolic pathway, how it blocks? By binding to the beta tubulin, it inhibits microtubule assembly and synthesis. Drug is given orally, well absorbed, well distributed, including the brain. So even you can see the tissue anthelmintic. If it is others, the circuit, etc., which they are migrated to the brain and all, this can be used. The metabolite, what is a sulfoxide, is a potent anthelmintic. Adverse reaction, it is a well tolerated but very rarely dizziness. Prolonged use in hydatid cyst and also cysticercosis. They are used for longer period of time. It may cause headache, fever, alopecia, jaundice, neutropenia, etc. Slight caution when you are using for a patient with hepatic and renal diseases. Then contraindicated during pregnancy. Contraindicated in pregnancy. Then what are the uses? Cutaneous larva migrans, 400 mg per day for 3 to 5 days. Visceral larva migraines, that is microfilarial larva, 400 mg twice a day for 5 days. Then in filariasis, you are using not as an individual drug, as an adjuvant in combination with DEC or also ivermectin, that we have already seen earlier when you have studied ivermectin or also DEC. With that, the study of drugs used in filariasis is over. Any doubt? Hello? Any doubt? Okay, these are the questions, SAQs. What can be the questions from this topic? Describe the treatment of filaria or filariasis. When we say treatment, number 1, symptomatic treatment. Number 2, radical treatment. Number 3, chronic prophylaxis in endemic areas. All the 3 you should write. Okay. Now, when you are writing the treatment, first you have to write the drug or drugs, if it is single drug or combination. Second thing is, what is the dose? That means so many milligrams, once or twice or thrice a day. Then what is the route? Oral or parenteral, if it's parenteral, intramuscular, intravenous, subcutaneous, etc., etc. Then frequency, once a day or twice a day or thrice a day, whatever it may be. And the total duration for 1 week, for one course, or 2 to 3 weeks, the total dose is distributed, then give a gap of 3 to 4 weeks, then another 2 or 3 courses for radical. So when you are writing the treatment, even in your prescriptions, so drug or drugs, the dose, route of administration, frequency, and total duration. So all these points should be there. Next type of questions may be an individual drugs in the form of a short note. So here you write a short note on diethyl carbamazine, diethyl carbamazine citrate (DEC), or ivermectin or albendazole. Let us see if these drugs are asked. Whenever an individual drug is asked, first thing is you should write to which group it belongs. Then what is the mechanism of action? Then pharmacokinetics, absorption, metabolism, excretion, adverse drug reactions, drug interactions, contraindications if any, if there are any contraindications that you have to mention. Then what are the uses of this drug and what are the doses? So whenever an individual drug is asked, you should mention the group, its mechanism of action, pharmacokinetic properties, adverse drug reactions, drug interactions, contraindications, uses, and dose. Do you follow? Hello? Can you hear me?
Yes.
Okay. So this is your assignment. You have to answer. There is no necessity of submission. This is an assignment for yourself, assignment for yourself. You answer this in the format what I have told you. With that, we are concluding today's topic. Thank you.
Thank you, sir.
Yeah. It is over. Yes. Now I have to go first. This recording has to stop.
Yes, sir. Stop recording. Yes, sir. Yes. Stop recording. Click there.